So your baby has a diaper rash now and you're wondering, how do I fix it? Welcome to the Baby BFF. I'm Dr. Candice. What causes diaper rash? Babies in diapers are actually sitting inside of a wet environment. Remember, every time they pee, every time they poop, that diaper is wet. It puts the skin at risk for damage. So essentially, all of that wetness and moisture in your baby's diaper is what is causing the diaper rash in the first place. It just irritates the skin, but there are ways to prevent diaper rash. You can check out my other video on how to prevent diaper rash. So hopefully once you get this cleared up, it doesn't happen again. How do we fix it? We need to change our baby frequently. Remember, the drier you can keep your baby, the better. When you are cleaning with your wipes, you can also have a little washcloth nearby, and you can go ahead and you can pat that area dry before you put on the new diaper. When we're wiping, especially irritated skin, we need to make sure to be very gentle and be very careful. And we need to try to just pat the skin and remove if there's poop or pee on there and prevent a lot of wiping. Make sure that you utilize some sort of barrier cream if your baby already has a diaper rash going on. It's really important that when we see a diaper rash starting to develop that we act quickly so that our baby's not in pain. Either Aquaphor or Desitin, they work really well. But remember, you want to put on a lot of Desitin and a lot of Aquaphor on your baby's bottom. So if you open the diaper and you're going to change the diaper and there's only pee in it, and you have a nice barrier, very thick barrier of that Desitin on your baby's bottom, that Desitin is actually preventing that urine from getting onto your baby's bottom. So at this point, all you have to do is take your wipe and you can go ahead and pat. You don't need to wipe off that barrier cream every single time. Obviously, if your baby is sitting in a pile of poop, yes, you're gonna need to go ahead and remove that barrier cream and then reapply. But remember, this skin is irritated and it hurts and it's trying to heal itself. So we just need to be very, very careful with our wiping. I don't necessarily have a recommendation on a certain type of wipes, but if your baby is really sensitive, many times in the NICU setting, we will actually utilize water wipes that they do not have any sort of chemicals or anything in them for babies that have really, really sensitive bottoms. Go ahead and check out the other video on how to prevent diaper rash. This will clear up in no time. I do not want you to think, oh, I'm a bad mom or I'm a bad dad or a bad babysitter because my baby got diaper rash. It happens. It happens to every parent, so you're not alone. I'm Dr. Candice and I'm your Baby BFF. I hope this helps you.